trafficking is a really complex issue. It overlaps a lot of things. So for each person, we have to look at what is the most pertinent piece of their recovery to start with. And a lot of times, especially for adults, that's the addiction piece. Let's help you get that under control. And then we can look at housing. We can look at education. We can look at, long-term career goals, things like that. But there's just so much layered on top of things for our survivors that it is really hard sometimes to figure out where do we start to untangle that. So again, that's where having an advocate, having these partnerships, being able to bounce ideas off of other organizations, or just knowing that we don't have to do everything for somebody. We can connect the dots for them, and then that empowers them to access the things that they need. One of the things that we know about survivors of trafficking is that, like anybody else, they have health issues. We want to make sure that providers are educated about trafficking, what it looks like, what the manipulation looks like, how patients are presenting so that it can be identified in that setting. And then on the flip side, we have survivors that have medical needs that a lot of times don't have insurance, don't have means to access those services. And sometimes those medical needs are long-term and ongoing from, after effects of things that they've been through. So having, again, both sides of that, us being able to educate frontline medical workers, and then having those services available for survivors when they are identified, it's just a win-win.